We had the news today that the UK was the first Western country to actually approve a vaccine. What does it mean for regulators across the world? How quickly will we see approval in the US?
You know, I think it's the first in many approvals to come for all of this work that everyone has been doing so hard to get these vaccines ready to go. I think we won't be far behind in the U.S. with Pfizer and Moderna already prepping their submissions for emergency use authorization. We're hearing that they'll be reviewed sometime next week. So it's exciting news for sure.
Lauren, I look at where we are with the vaccines out, plural, and it all comes down, and I mentioned this earlier in the hour, folks, to booster shots, to how we actually make it that last mile, that last walk across the room where you kill my arm with a shot. What's your visualization of how we actually do vaccines? What's going to look like in the doctor's office when the nurse holds my hand?
I have a feeling it's going to look very much like the flu shot in a general sense, right? So you'll come in, you'll get your vaccine, and you'll go home. And in these first phases of the prioritization where we're trying to target these most high-risk populations, there will probably be vaccination stations set up. But for the general public, we'll have a system in place where we can get them in, get them vaccinated, make sure we have rigorous documentation on what vaccine they got and when their booster should be, because they're all going to be slightly different for the different vaccine types that are out there. So the two pieces that are that the people are going to see getting the vaccine that are going to be really important are coming to this certain location to get the vaccine, just like you would a flu shot, just like you would your childhood immunizations, and then getting that booster. And the information that we give to the people about how and when to get that booster are going to be really important.
So when you and I are watching Orioles Red Sox at Camden Yard late in the year with the Red Sox in first place and the Orioles usually in last, who are we going to know who had the vaccine?
Well, I hope that the Orioles will actually be in first place to start, because I think that's really important.
Good luck with that.
Yeah, we can all dream. We have a vaccine right now.
But there you go. Anything's possible.
Exactly. I think that we won't know who has the vaccine and who doesn't, and it'll all depend on that rollout schedule, right? But we will have a lot of people vaccinated, and that is a huge first step. Oftentimes you don't know who, when you're sitting at that game, you don't know who has their flu shot either, right? But when a bulk of the population have that vaccine, you have a little bit more of that herd immunity type protection that we've been hearing so much about. And the vaccine is the safer, more strategic way to get there.
So, Lauren, first of all, how much, what percentage of the population needs to be vaccinated to reach herd immunity? And how many people just, either don't believe in COVID-19, they think it's a hoax, they don't want the vaccine? Like, how many people will refuse to have this shot?
I think that's one of the biggest things that we're worried about. So I don't have a good sense yet of exactly the numbers of the population that have to be vaccinated. And there's a lot of work being done on that. It depends on the natural immunity in the population, the levels of people that have already been infected, how we roll that vaccine out, and who we target within the population. So protecting that vulnerable population. The key, though, exactly as you're noting, is to make sure that we communicate how important and how safe this vaccine is so that people get it. Because we could have the best vaccine, the most effective vaccine in the world, and if people don't trust it and people don't believe it, they won't get it. And then no one's sitting at that baseball game. And that is huge, because we have a ton of scientists working on creating these safe and effective vaccines. We have a ton of supply chain people working on the processes to get them safely to where they need to be. And we have a ton of data analysts working on the most effective ways to ensure that we're tracking who's getting what vaccine and when they're getting their booster. So we also have an obligation to communicate with the public about how important this is, how safe it is, what the processes look like, and why COVID-19 is real and it can kill you.
What's the process, Lauren, or the timeline from that first vaccine being distributed in the U.S. to, the last person being vaccinated? Is that a 6-month process? Is it a 12-month or even longer?
I think it could be 12 months to longer. I think it'll depend. A huge portion of it will depend on that communication program, but also the supply chain. So how fast can they ramp up production, right? So we're going to have several different types of vaccines coming online over the course of the next year, and having a plan to produce them and get them out safely. Obviously, the Pfizer one requires significant cold chain storage. The Moderna less so, but still has to be refrigerated and stored appropriately. Some will have booster shots and some will not. And so tracking the logistics of all that is going to impact how quickly we can get the entire population vaccinated. I would say it's reasonable to expect that we'll have a large portion of the population vaccinated by the end of next year, and then getting to full coverage by the following year, assuming we put that communication plan in place and assuming people trust it and are willing to take it.
Lauren, how is the virus changing without talking about, mutation, which is, could be of real concern? Does the virus change enough to have to change the vaccine in 5-6 months?
I don't think that we're going to see a dramatic change to any vaccines in 5 to 6 months. I don't think we're seeing new strains that would impact that in that way, or mutations that would impact the vaccine in that way. I'm not a virologist, so I can't really speak to the details of how the virus is changing, but I think we're confident that the vaccines that we're creating now will continue to work broadly in the population.